Under Jersey's domestic abuse law, the courts can require perpetrators to complete a probation service course aimed at tackling abusive behaviours in their relationships. Meanwhile, Jersey Probation and Aftercare Service are working on broadening the audience of their programme, opening it up to people who refer themselves and changing its name to Building Healthy Relationships. Natalie Elliott and Kay McCarthy from the Probation Service spoke about the programme and why people shouldn't wait until they get arrested to get help. I'm Megan Davis, and this is Bailiwick Podcasts.
Yeah, sure. So I'm Natalie Elliott. I'm a team manager at Jersey Probation and Aftercare Service. I've been in this role for about 21 years, or working at probation for 21 years, and been a manager for the last 5. This is Kay. I'll let her introduce herself to you.
Hi, I'm Kay. I'm an assistant probation officer with responsibility for coordinating the Building Healthy Relationships programme. Previously worked in probation in the UK and historically in Jersey. For the last few years worked with victims of domestic abuse.
With Frida, so lots of really good contacts we've got with the services. And I think so, Dr. David Briggs, he's a forensic psychologist. He wrote our programme for us a couple of years ago, and we do lots of training with David 3 times a year. Domestic violence, and actually work around sex offenders as well, which is obviously we're not here to discuss those today. We recognised that we wanted to have something that we could. Previously, we had a programme that was called Adapt, and it was a group programme, and it was one size fits all, if you like. So everyone did a group programme, and we recognised that actually it's not suitable. Not everyone's suitable to be in a group environment for lots of different reasons. And it was also purely for men, whereas this programme has been devised so it can be for same-sex relationships, the LGBTQ community, and obviously men. A majority of the people that are doing it are men, and we recognise that. We don't shy away from that. That is the reality. So we initially had the programme. It's the same programme we had, but we were coming up with a name at the time, and we called it very unoriginally, the Jersey Domestic Abuse Programme. And we just wanted to say what it was on the tin. And Kay joining us, you started a really good piece of work getting feedback from clients, didn't you? And some of the feedback, if you want to say a bit more about that.
I think some of the feedback, the clients said the title or the name of the programme is very stigmatising. Nobody wants to sign up to a programme that's already labelling them when they are trying to address the behaviours. So one of the instances was somebody had to ask for time off work. Where would they tell their employer they were going without that employer thinking, who have we employed, or where they're going? So did a piece of research, and one of the clients came up with a Building Healthy Relationships programme, which sounds a lot more healthier and sounds a lot more less stigmatising.
And it's ultimately what we want to do. We want people to have healthier relationships, but within the actual programme, we recognise that there needs to be that balance of challenge and support. I think one of the things we mentioned earlier before we started is about how you actually get people to engage, and recognising that it isn't suitable for everybody, because not everyone will be ready to make those changes. They might be in complete denial. We can work with people who are on their motivation, if you like. We do have skills we might use and ways of working with them, some motivational interviewing to get them to recognise that actually their behaviour is not helpful for them, and that might get them on board in order to be able to start the programme. But we do a really thorough assessment of people beforehand, which also involves a risk assessment tool, which is called a SARA assessment. It's standardised, it's used in the UK, and that is about checking where the risk and needs are, so we can make sure that we can have a programme that's actually suited to that individual.
Could you talk me through the changes you've made to the programme?
The only significant change is the name, actually. So Building Healthy Relationships, and we're just working. Kay's working with a team to try and get a new logo and things out, so we'll be launching it hopefully in the next, would you say, couple of weeks?
Yes, hopefully. Once we've got our publicity ready, it'll be ready to be officially launched. We've got a little soft launch at the World Social Work Day event up in Highlands College. I'm just getting the presentation ready for that with the new name. But yeah, I think when we've got the logo done and it'll be easy recognisable, you know, and not stigmatising, then maybe we'll get more people in to do it. Yeah, the content hasn't changed as much as in that the modules haven't changed themselves. Yes.
Yeah. What's in those modules?
Okay. So I'm just going to bring them up just so I get it right and I remember. Although I think
initially it's formulation, isn't it? Assessment, and that takes a number of sessions. Well, I think as many really as it takes to get the full information and the big picture, isn't it?
Yeah, at least. So we would definitely. So the clients we have come either through the court system, so they're on statutory probation orders, or they might be in custody, or they can be self-referred from other agencies. And as we said, people can self-refer as well. So the initial stage is before we'll accept the referral, but we'll need to do the assessment, see if they're suitable. So that initial stage, the assessment process, that's one of the modules, if you like. It's like a pre-module. And that assessment is to ascertain their level of motivation, if they're accepting responsibility for their behaviour, sort of reasons why they want to do the programme, also their availability, if they can, you know, when they're available to come in and do it. It's not suitable for everyone. So if somebody has, for example, got alcohol or drug dependency issues, they would need to be addressing that first before they could do the programme. The same if somebody's got significant mental health difficulties, and by that I mean a diagnosis and they're perhaps not engaging with their medication regime. So it's really important that those things are addressed first. It's an adult programme, so it is for adults. I think they would be perhaps the sort of main ones we'd have to sort of go back and say, no, not at this point.
They've got to be at a point in their life where they're ready and they to engage with us and take on board some of the responsibility, for the abuse or, you know,
absolutely. So the assessment process, Megan, looks at obviously we interview the person that's come in, so we'd see them probably 2 or 3 times at least. We get their consent to liaise with partner agencies, so if they've got children, we would contact Children's Services, JDAS, so the Id for Service as well, police, to check there's been any police call-outs, and any particular services they're open to. If they are open, for example, to drug and alcohol, but aren't dependent on anything, we would get their consent just to check that are they in the right place to be able to start that programme. I mentioned we do a SARA assessment, and that is for us to be able to really analyse what the risk and need areas are with that individual. If appropriate, we will also liaise with victim services to speak to their partner, but we have to do that very sensitively because obviously the priority is ensuring that the victim or their family or victim survivor is safe. So we would never risk putting them, you know, at any kind of danger for doing that. But it's really important so we've got a more of a balanced and holistic idea of what's going on in that person's life. And based on that, if they are motivated and they're saying, look, I do recognise I need to make changes, and it might be for reasons to do with their children or whatever it might be, we will then formulate a plan for them. And I'd say all in all, most of them do most of the programme because I think all of the modules are relevant. But because it is personalised, the probation officer can determine how many sessions they might need to do. So if somebody has done lots of things over a number of period of years, they'd be expected to run through the whole programme, which was going to take about 9 months. It's quite lengthy.
We did count, yes, yeah.
And so people have to be prepared to commit to that sort of time frame.
It's a big commitment, isn't it?
Yeah.
It's not over a couple of weeks. It's a big commitment.
It is a big commitment, but I also think if people are serious about making the changes, then they will be prepared to do that.
Yes.
And so that's primarily what happens. So the other ones are we look at people that maybe are a little bit resistant or are more questioning more about things. We do something called it's about building precursors for change. It's about preparing them to sort of how to get them more motivated to perhaps address their behaviours. I'm just looking on here. developing their skills to change, so looking at attitudes and behaviours. And I think one thing our team are really, really skilled at, and that's because of the amount of training we invest in, I think, with David, who wrote the programme, Dr. Briggs, is about motivation interviewing. So really building that relationship. I think you have to, for any of the work we do here, regardless of domestic violence or not, you have to really spend time, and I think that assessment stage is really important, to build a bit of trust between you. So the very fact that someone's come through this door, they don't really want to be here, we know that, and it's about helping them not to feel judged, and having that rapport, building that relationship.
And I think it's about ensuring that the toolkit then, the modules, are appropriate to the way they learn. So it's about adapting the programme to suit their own, capability or the way they learn, isn't it? It's about, looking at the need and adapting up those things to ensure that there's an understanding.
And that's another benefit, I think, about this programme, or the one-to-one programme, is because, Kay had an example of somebody who had was going through a sort of diagnosis of autism, but they're very high functioning, but in a group setting, very difficult to perhaps adapt that for them. So that was a really successful piece of work, wasn't it?
Yes, it was, yes. So I adapted the worksheets so they were more on point because it was lateral thinking. So changing the maybes to the different questions, so you get a yes or no. So and that was really. It was a really good piece of work, and the feedback that we got from that gentleman was really positive about his experience and how we had taken the time to do that in order for him to understand the tools.
And I think as well, as I said at the beginning, working with other agencies who are working with that family. So that particular case, Children's Service were involved, weren't they?
Yeah.
So you're getting some sort of feedback about how things are better in the family home as well, and how changes have been made. So. We want to work more. Part of our goal is to be getting much more feedback, so we can, we can hopefully by the end of this year be able to have a lot more rich data about how effective it is in terms of perhaps reoffending rates, for example, because we're perhaps too early on, I think, to be able to provide that at the moment.
You mentioned that you're also open to supporting LGBTQ people and women as well. Are you seeing any at the moment?
There's one person who's currently doing it at the moment, who's in a same-sex relationship, and that's ongoing at the moment. You mentioned earlier about the law, so the new domestic violence laws come into place. In fact, I think this was the very first one that came in, which was great because there's a requirement for them under the new legislation to do the programme. So they're kind of having to do it, but actually they'd already started doing it with their probation officer at the time, so their level of motivation was already fairly good. But I think it's really, really important that we, wherever possible, we can use this legislation to help us, get people through the programme.
Yeah, absolutely. And you've mentioned every time we've spoken, I think, that safeguarding and keeping sort of focus on the victim is really important. Could you just speak to what you put in place to do that?
Yeah.
So I think we work in partnership with the safeguarding agencies. So initially when we get the assessment, the referral in, and we do a holistic assessment, so that would be working with the safeguarding agencies, JDAS, to see if they've got an IDVA, Children's Services. So it's about remaining in contact with those and the police. So if there's any escalation or there's any call-outs, they'd be notifying us because they know this person's on the programme with us. Getting feedback from the IDVA. If there's an escalation, two-way process, we report in one side, they report in the other. Attending Children's Services meetings, care proceedings meetings.
Yeah.
And it's about being involved in all the aspects of that family's life and being able to say, if there's an escalation in risk, and being able to say that in front of the perpetrator, because that relationship would be that good that you'd be able to say that, and then getting feedback from the other agencies about what that life is like in the house, and again about victim support, having the voice of the partner fed through the different agencies back to us, about what's being reported to us is really the bigger picture of what's going on, isn't it?
Yeah, absolutely. So I think in any of the work we do, we can't do this work in isolation. I think any kind of safeguarding work, I think any department or agency would say that to you, has to be done in a multidisciplinary way. You have to work together to manage that risk. But again, we always prioritise the victim's safety there. So there may be, whilst we, needing to be transparent with people, that would always be the priority, would be that victim's safety.
And then in terms of when someone comes to you, what's the sort of first point of contact? I imagine there's quite a lot of different scenarios, but sort of when do you first see them and when do you sort of last see them?
It's all different, isn't it?
Everybody's different.
If I go through the statutory side then, Kay, perhaps talk about the voluntary one then. So for some of the cases, I'd say at the moment the majority are people who come through the court system. So the probation officers are all officers of the court. There's always a probation officer in court every day. If the magistrates, or if it's a royal court remand for sentencing, there'll be a period of time, a few weeks, where they'll say we'd like the probation service to prepare a report for sentencing where we do assessments. So the first time might be that person coming through our door because they've gone to court for their offence or offences, and that's allocated to one of the team here, and they interview them about everything. It's a bit about their life, a bit about their current circumstances. We get our lateral checks are done, again, safeguarding checks. We get all the police information, the criminal record, all of those things. So we're able to formulate a really good risk assessment plan, and then we'll make recommendations to the court, which might be, for example, a 12 or 18-month probation order with the condition that they do this programme. And if they're therefore bound by that to do it, and if they don't, then we would take them back to court, and the court would either give them another opportunity possibly, or sentence them in a different way. So that's one of the pathways, is coming through the court process, where they then are required to attend. And obviously the new domestic abuse law, we've got that additional law in place as well. And Kay, if you want to talk about the other pathway.
So if it was an agency referral, the referral form would be completed by the agency with all the concerns, and the client who's being referred would have signed that, so they know what's on there. And our next step would be to do the safeguarding issues with all other agencies, because they'd have on the form it'd say that the safeguarding agencies will be contacted, and then we would invite that client in for a first initial interview to find out what's their motivation, how motivated are they, their availability, talk about the programme, tell them it's not a quick 10-week programme, this is a fair commitment, and I sort of assess their commitment to see if they're going to stick at it. And then there's a few more assessments ongoing, and then a decision is made whether that person is suitable for the programme. It may be that they're not taking responsibility for their behaviour, and there's a tick box in children's services, hopefully not, and they would engage, yes, but then the decision is made. So it's like, yes, you can undertake the programme, or no, you're not ready. For somebody who is self-referring, so there's a referral on our web page. Somebody's self-referring, then initially they would be brought in to discuss their application and then sign the safeguarding checks, and then they would be done and the process starts with them. But if there was any agencies working with that person who'd self-referred, they'd have to come in and on board and be recognised that they're all working with the family, yes, or the person. I think
I just want to reiterate how important that is. So, for example, I'll give you an example. If there is somebody open, and I'm going to use children's social care only because that's probably the most likely referrals I think we would probably get at the moment anyway. So if they're referring somebody in and we say, yes, they're going to start the programme, they seem motivated, we're going to start that work with them. If they then say, well, that's great, everything seems fine at home, so we're going to close their case, or it's no longer got to be open to us, we would be saying, actually, we think it does need to remain open, because we are the people just doing the programme, and if it's close to children's social care, we wouldn't necessarily get the feedback of how things are going at home. So I think it's really important, again, going back to that, working together with partner agencies to make sure that everyone is playing their part in making sure that domestic violence is, hopefully eradicated.
I think if the agency is referring them to us and it's a 42-week programme, the agency should expect to keep them for the 42 weeks. Because that is the safeguarding pathway, isn't it? We've got no safeguarding if there's no other agencies involved. Yes, we can't check on how the children are doing if there's no involvement there, because we would have no consent to contact them.
To do it.
Yeah, so it is about the agencies recognising that it's not a quick fix either.
Do you find they're generally quite good at that? Other agencies?
I think it's mixed, if I'm honest. I think it is mixed. And I think what happens is, but we will get back to them. Kay in her role will get back and say, actually, if they're going to be remaining, if we're going to do the programme, you need to stay open. We've got a piece of work to do, getting that message out more, I think, to services, and we've got plans to, as Kay mentioned at the beginning, we're going to the social work day at Highlands next week, and we'll go and do a presentation to Children's Social Care. We've done some, the Safeguarding Partnership Board do bite-sized lunch sessions, so we've done one of those already where people can come in their lunch break and we talk about the programme and what's expected. So we've got a bit of work to do ourselves as a service to make sure we're getting that message clearly out there. But it's very clear on our referral form, which is on the website. But I think it's just reiterating that. And I think it's quite difficult with some services who perhaps have got a bit of a turnover of staff. So we may be telling a group of people, this is what you need to do, and then it might be that they've got different staff and that message isn't perhaps filtering down. So it's clear on our information, but I think it is.
I think yes. I'd be talking to people 2 months ago who may necessarily be in the same position in 2 months' time.
That's it.
So it's about keeping that information fresh and out there, isn't it? Keeping it on the, on the agenda, and hopefully being out there and having the logo, because we didn't have a logo on the old programme. So having the logo that's recognisable, and the merchandise to go around the publications, and that they're out there in the public arena, in surgeries and places where people can think, I might have a discussion with somebody about that. I mean, we think people may self-refer, and if one does, for me, that's good. Because that's one person who's willing to address the behaviour. Hopefully, we'd have a lot more. But it's
On that, are you seeing any self-referrals at the moment?
We haven't been open to self-referrals prior to now. Yes, so they've all come through the court or children's services, drug and alcohol.
So you're hoping to
we're hoping to,
something I'd be curious to sort of hear your perspective, your experience on, is how do you speak to people about their behaviours? Because it must be really hard to hear that the way you behave in a relationship is actually abusive.
I think that it's about the language you use. For me, it's about the language, and it's not saying it's abusive when, we probably would know that it is abusive. But you may hear that after you've built that relationship up, and you can suggest that's quite abusive, but initially to build there, you would say that's not quite healthy, and using the appropriate language to soften it. Over time, that language can change, and because it is about support and challenge, so you may change your language over time, but initially it's about using the softer approach, isn't it, to build up, and then people feel more, to be able to be open and honest, with you. So then you would say, so that is quite abusive.
I think it's getting people to name it themselves as well. And again, as Kay said, in the early days, when you first meet any relationships, isn't it, you kind of have to build that trust a little bit. And so it is about, I think the initial thing is acknowledging people are here and saying, thanking them for coming and saying it's a really, for some people it's actually quite brave to do that. They're acknowledging that they've got a problem, which is very difficult. People don't like doing that. We're human beings. We don't always like to accept that, we've got tweaks, but they don't like that. But the very fact that they've come through the door, some of them reluctantly because it's via the court, But as I said, I think our team are really skilled in that relationship building, and that is about, as Kay said, asking them about them. I think a lot of that is about people like to talk about themselves, and I think it is about sort of building that and then acknowledging, the fact that, we're really pleased that you're here. I know it's not easy for you, but actually we want to support you to make the changes. So it's not about us making the changes, it's about them doing it, but our programme will give them the tools in order to do that, give them different scenarios, give them different situations. They're really having to, on this programme, to really think a lot, because there's loads and loads of different skills and tasks in the modules, and they can't really shy away from things. So they're having to really think about their behaviour. Sometimes we'll use third person scenarios. So can you give an example of this situation? If this was a couple and they might be quite similar to their situation, and just see what do you think is healthy about that, or is there anything wrong about that relationship? And then you might do that for a week or so, and then perhaps say, let's look at your relationship now. Can you see any comparisons? So I think it is, Kay said, it's using that language and building the relationship so that people feel safe to be able to open up, to us.
And I think for me, there's learning for them, isn't it, about why they behave. Yes, like that. And that could go back to their own childhood. That could be, a learned behaviour. That could be something that they just think is the right thing to do. So for some, it's about, that's why I do that. So the penny kind of drops, and, I recognise now that isn't healthy, that I did that and that was really abusive and that's wrong. So it's about them understanding themselves. And one of the quotes that I did from the feedback for one of them, and I said, if you could sum up the programme, what would it be? And he said, understanding me. Yes, so that was about him, and we were saying about you can't shy away, and there's homework, and he was saying about COVID and how useful that was for him, because it gave him time to reflect on his own behaviours, where he didn't have to go to work, and he didn't have to rush off to go out with his mates or go to football, whatever. And he was saying about how COVID allowed him to sit there and think about his actions and how he could change. And then his summing up of the programme was understanding me. So, when thinking about what has changed his behaviour, I was being selfish, now I consider the wider prospects, it's not all about me. And this is 3 years on, yes. And he could give me examples of the tools that we gave him, he's using, of how in a relationship, how different it is to the last one. Yeah.
So is this someone who did the programme?
Yes.
Back in 2020?
Yeah. So he did it through COVID. So what has changed? I now think about the other person and how they would feel. He said, identifying areas. The programme was useful to him. He was identifying areas I might not even thought I was being abusive. And he said, it's giving me the tools to progress and to stop, and an opportunity to talk about it. He was talking about the trust he had in his officer, and how that relationship allowed him to say anything without being stigmatised, without being thought of, as a bad person, and that was important for him. So, and then one of the most important things that he learned from the programme was tools to look after myself. It's about keeping himself safe, so he didn't abuse. Being able to talk about myself, and my tools to help with anxiety. But he said about understanding why and what led me to do it was a big part of his learning. So, there's some positive feedback there.
Absolutely, yeah.
That he's still thinking about 3 years on, so that, not everybody will give that feedback, but for him it's life changing.
And ultimately for partner,
for the partner,
for
the new relationship now, and they'd moved in together, and the chances are they have a family. That family would be a lot better off for him doing that programme, or a lot safer, and the partner.
I think one thing we will say to people when they finish as well is, the door's never closed. And, we don't want people to be here forever. They don't need to be. You give them the skills and the tools, and then they need to go and put them into practice. But if somebody 6 months, a year down the line got back in touch with us and said, you know, I'm struggling again. Can I just come in and have an initial conversation? We would do that. We certainly wouldn't be saying, no, sorry, you've done the programme, you can't come back. It might be they just need a little bit of top up talking about, for example, one of the modules is about partner relationship functioning. It's called that. So it's about their actual relationship, about how they communicate with each other, respect, and so it's just perhaps reminding people of those things again. And we mentioned about the impact of domestic abuse on children. Whilst we would do that with any person who's got children on the programme, we've actually found it's been useful with people who haven't, because as Kay alluded to there, it's helped people understand perhaps some of their own learned behaviours. And that's not to say that everybody who's been brought up in an environment where there's domestic violence go on to abuse, but we do know from statistics that sadly often is the case. So it's about breaking those cycles.
So yeah, I've got a feedback, a quote from a gentleman who had 3 children, and we did the domestic abuse, the impact on children. He said, I found looking over the facts and research of how others, children in particular, can be affected by what they see and even hear just the once. So that, you know, for him, the chaotic lifestyle and the children, there was no recognition of that, how that was affecting them, because people think children are in bed, they don't hear, you know. We can be in the next room, we can hear, children can hear, they pick up on vibes, you know. So there is
I think as well, isn't it, that myth about children, you know, well, they weren't at home, but you pick up, as Kay said there, you know, you pick up atmospheres at home, you pick up when things aren't right, and that's really significant for children from very, very early age.
But even pre-born children.
Yeah.
And so the scenario that you know, you would use to get somebody to understand now would be put a scenario that's familiar to them. So you're going into work. There's an atmosphere in the office. How do you feel? Why is everybody, you know, tiptoeing around you? You can feel that. Children feel that. Yeah. So it's about relaying something that they can understand. Yeah. And then they are summing up of the programme. It was informative. So there's you know, there's a lot of learning.
Yeah.
Can I just ask for some idea of how many people you tend to see maybe over the course of a year, rough numbers, and then how many of those complete the programme?
I can pull up the statistics and email you after, if that's okay.
That's fine, yeah.
I think we had, and it's just off the top of my head, I think we had 33 last year. But I'll have to go and have a look at who they are, because some of them will be people on orders and voluntary, or perhaps we've done it with 2, I think, in custody. So the probation team, that's another thing at the programme. So Carly, who's the forensic psychologist at the prison, she works very closely with our team, and where we can, obviously we're limited because of staffing resources, but where we can, if somebody's serving a custodial sentence, if it's appropriate and they're suitable, we can start the programme in custody, and if they want to continue to do that in the community, or if somebody was on a probation order, for example, and were doing it, and perhaps they might have reoffended and went to prison in a different way, there's still that option to continue the programme. So we can work across custody and the community as well.
And so who delivers the programme in practice? Is this probation officers, is this yourselves, and then how many of us?
The probation officers and Kay. Well, Kay is assistant probation officer. Yeah.
One final question. When I came in, you had the service values on the wall in the waiting room, and when that really struck me was recognising people's capacity to change. Would you be able to speak to that?
Yeah, I think the very nature of the work we do, we wouldn't do this job if we didn't believe people have got the capacity to change. I think sometimes it's just the right time, needing the right time or the right support to do that. We recognise that change doesn't happen overnight, and for some people it can happen very quickly. With other people it can take a lot longer, and it might well be, or we know with lots of people that we work with, that there are they won't happen straight away. They will get things wrong. They're human. They'll make bad choices, wrong choices, but it's recognising that if that happens, it's not a case of saying, well, that's it. It's a case of saying, well, okay, how do we help pick you up again and let's start again. So I think it's giving people that hope. I think acknowledging that people with the right support and skills around them can make the right changes. Ultimately, they have to want to do that, but sometimes I think they need that bit of hand-holding, a bit of guiding. There was an analogy that in a completely different context, someone spoke to me about, talking about kind of dolphins, if you like, which is quite interesting given yesterday's information about, and I do see the team here, if you like, a bit like that, in the sense of sometimes they need to be just behind people, nudging them along, helping them. Mm-hmm. Sometimes you're swimming alongside people if they're doing all right, and then other times you need to be just in front leading the way. And I think in terms of that capacity to change, I think there are different times. Everyone's very individual. Everyone's treated, as individuals when they come in here, and it's about us looking at where they are on that cycle of change for them. What, how motivated they are, and what we can do to help them get there.
And I think it's okay to take a step back, isn't it? As long as you recognise and take a step back and you take that step forward, and like I say, we'll always be there to support people. Absolutely. Because there's no judgment, is there? It's, there is, come on, never mind, let's start again kind of attitude. And I think we wouldn't be in this work if we didn't really believe that people can change.
No, that's it.
Yeah. So, yeah.
And how can people reach you if they want to find out more, if they want to potentially inform themselves about the programme? Okay, well, they can go onto the government website, click on probation, it will come up, or they can call us. People can walk in if you like, there's always a duty officer, or they could ask for Kay, who's our programme coordinator. We want to make it as accessible as possible, so people can either call the number. Our contact details are all on the website as well if they want to do that.
I think when we've got the publicity and we're out there more, it'll become more visual, and it could be on our Facebook page, yes, and people will be able to contact us, because there'll be lots of arenas to get in touch, making it easier for people.
Yeah.
But not everybody can manage their way around the government website. Or maybe not want to, but yes, about us making the public aware that there's other arenas as well.
Yeah. Brilliant, thank you. Is there anything you'd like to add, anything you'd like people to know?
I'm not sure if we covered, so if I just tell you what the modules are, because I don't know if that was fully covered. So there are, if you like, there are 8. I would kind of say there's 7, but so there's the assessment and formulation, which is a kind of if you like, but we include that. There's building precursors for change, so that's that kind of motivational stuff for people that perhaps aren't quite fully on board, and our job is then to get them there. There is skills for change, which is looking at their attitudes and behaviours and different scenarios. There's a module on the impact of domestic abuse on children, which I think the feedback generally is that's always one that people find really eye-opening. Partner relationship functioning, which is just about obviously looking at communication, respect, covers coercive control, things in there. Anger in general, if people have got issues around anger, people might think everyone who's on a domestic violence programme must have issues with anger, and yes they do, but it's slightly different. We're talking about anger in general. We've got a session on trauma, but trauma actually, for lots of people that we work with, they've got traumatic histories for their own, might have grown up in environments with alcohol and drug dependent parents or domestic violence. So whilst trauma is there, it kind of trauma sort of feeds through all of the programme, and we would refer on to relevant agencies if people have got sort of significant trauma they need to address as well from their own histories. And finally, but this is a really important module, is the bringing it all together. So the bringing it all together module is obviously right at the end, where you're reviewing everything, and that's where we're really looking for evidence of that learning. So they're showing they understand, that they're giving, they're able to give examples, that we're also, all the way through the programme, as we alluded to earlier, we will check with the involved agencies to make sure that things are okay. So part of that is all about that, and it's great at the end to be able to sort of celebrate somebody getting through it, but recognising, that we are here if things don't go well. We're not naive enough to think that people are going to do this program necessarily, and that's going to be the end of it. We know that it may not be, and sometimes somebody might get all the way through the program and we still have significant concerns about their behaviour and attitude, but we will be letting them know that all the way through, and just reiterating that and making sure services, because that would be primarily with people who have got that kind of resistance, I think, to change. But I just think it's important. Obviously, our goal is to try and give them the skills, but ultimately people have to be on board to take them on, don't they?
And when they go in through the programme, if there's any escalation or if there's any police call-outs or any concerns, we will work with that to look at the reasons why, rather than say you're not suitable for the programme. If they accept the behaviours and they can move on from that, and we can discuss that and find out why that escalation or the control, there was an increase in that. We'd look at why. Yeah, definitely. Yeah. But you're right. You can give people the tools. It's up to them if they want to use them or not. They can. Yeah. They can say they are, but hopefully with all the other agencies involved, you can assess whether they are actually, using them and. Yeah.
Thank you so much for all your time.
Thank you.
Thank you for listening to the Bailiwick Podcasts. For more on this and for more stories, visit bailiwickexpress.com.